Hi, I'm Theresa Chapple-McGruder. I am the Center for Health Equity Director and Associate Faculty in Health Policy and Management. My research interest is in health equity, looking at racial and gender differences in health outcomes. Most of my research is focused in on fetal death, infant death, and maternal mortality, and looking at factors that lead to the disparities that we see across races. I do really cool stuff. I consider myself an applied epidemiologist, and that means that I see research projects all the way through, not just to the results, but actually moving from results into implementation, moving from implementation into policy, moving from policy into systemic changes. And so I really love anything along that continuum. One of the projects that I can remember most is some work that I did on infant mortality in Memphis, Tennessee. We were looking at racial disparities in infant mortality and ways to address those. We ended up turning an old mall into a one-stop shop for all maternal and infant health programs. So you can go there for your WIC, you could go there, we put a grocery store there, so once you got your WIC vouchers, you were also able to go and get your food from WIC. Full circle, everything that a woman and baby needed to thrive and survive. All health is based on policies. I didn't learn that until I was out in the real world, working as a leader in the health department. Really found out that the policies that politicians are making all have some type of health impact, whether they intend for that to happen or not. And so really understanding policies from a health and all policies perspective makes it where you can have a better leg onto what the community might be experiencing and a way to actually figure out how to change those outcomes. I learned about Pitt Center for Health Equity when I was a graduate student nearly 20 years ago. The work that they were doing here in Black and Brown communities in order to make a difference in health status is something that I started researching Pitt's approach when I was a student in North Carolina. So I'm really excited 20 years later to be at Pitt, to be running the Center for Health Equity, and to hopefully have the same type of impacts on future students as the work 20 years ago had on me.